So hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is nothing but pediatric X-rays. In this session, we're going to talk about top 100 important the things regarding the X-rays. Okay, I'll be talking X-rays one by one, and I'll be telling you what highlighter is important for us to understand for that X-ray. Question number one. So what did you write for this question? So we all know that, right? So most importantly, can we appreciate in this X-ray? What can we appreciate in this X-ray? So can you see that? Very good, Dr. Megha. Pleural effusion is the right answer. So just normally this heart is there, right? We all know that. So this one is the cardiophrenic angle, and this one is the costophrenic angle. So number one, what can you see? I can see the obliteration. Very good. Obliteration of the cardiophrenic angle. Cardiophrenic. I'll be telling to the point. I will not be telling you in depth and detail. I'll be telling you to the point, which is important. So obliteration of the cardiophrenic angle and the costophrenic angle, it is there. I can see in this picture. Okay, and Silhouette sign is also there. So please remember, if this is the heart, then this one is the cardiophrenic angle, and the corner over here, this one is the costophrenic angle. That angle is obliterated in this picture. Again, I'll be telling you to the point. So this X-ray most likely looks like to me as a case of right-sided pleural effusion. Question number two. Yeah, so what is this? Anyone, any idea? Question number two, what can you see that? So again, very important. What can you see? Yeah, very good. So homogeneous opacity seen over the involving the right upper and the middle lobe of the lung. So I think this X-ray, sir, it looks more towards the consolidation. Okay, more towards the consolidation. And listen, one more thing, everyone. We have 100 questions. If you have a very serious doubt or a long doubt, then you can ask me in the WhatsApp. If you have a very short doubt, then you can ask me here only. It is difficult to answer all the doubts as well as cover 100 questions. So short doubt you can please ask, and long doubt also you are most welcome to ask, but that you ask in the WhatsApp, because we have to cover a lot of questions. This much 100 also, if you understand, you are on a very good scale. So this X-ray, the best. How do you speak about an X-ray, sir? Homogeneous opacity involving the right upper and right middle lobe of the lung, number one. Number two, so this most likely looks like a consolidation. Number three, why it is not looking like a collapsed lung? Any idea? Can you give me one example why this doesn't look like a collapse to me? Because any idea? If the collapse would have been there, then what will you see? Any idea, Ramya? What will you see? Yeah, Aishwarya is right. Trachea, sir, trachea would have been shifted to the affected side, number one. Trachea would have been shifted to the affected side, number one. And crowding of the ribs. Crowding of the ribs. Okay, crowding of the ribs would have taken place in a case of collapse. Okay, again, I'll be there. I'll be talking to the point. Okay, very important. So crowding of the ribs will be there in collapse. Trachea shifting or mediastinal shifting towards the affected side will be there in what you call the collapse. And in consolidation, you don't see that. So consolidation is the best answer. Very good, Dr. Panikar. Next question. Let's see. Yeah. So what is this? Any idea? Question number three. What did you write? What is this? What is this? This is nothing but subperiosteal hemorrhage. Subperiosteal hemorrhage. Okay, there's nothing but subperiosteal hemorrhage. Very good, very good, very good, Aishwarya. So this is nothing but subperiosteal hemorrhage. So then nothing but it is seen in scurvy. Yes or no? Very good. So it is seen in scurvy. Okay, subperiosteal hemorrhage. So it is seen in scurvy. That you should know. Okay, I hope you're able to understand. Perfect answer. So scurvy is our best answer. Okay, next question. Okay, the answer is here only already. So what can you see in this picture? This one, what can you see? So this one, this thing, no, this like this one, this is like a cupping is there. Okay, this one, see cupping like that. So you can in this picture you can see cupping. Number one, number two, you can see frayed appearance, fraying. This one, this is nothing but this is fraying. Can you see that? This one, this is nothing but fraying. Okay, and what is playing? You see biting. Kindly mute your mics. Thank you so much.
Cool. Yeah, cool. So question number four was nothing but cupping, fraying, and splaying appearance. Cupping, fraying, and splaying appearance. This is nothing but this cup saucer shaped cupping is this is the cupping, and splaying, very important. See, cupping will be, if X-ray is there, no, cupping will be like cup shape. This one, this like this concavity, like a saucer shape, like a cup shape, that is known as cupping. What is fraying? This like burnt out, this burnt out appearance, like this it like it see this one, this burned out appearance, that is nothing but fraying. And widening of the wrist or widening of the leg, that widening area is nothing but splaying. So in that's a very basic meaning: cupping, fraying, and splaying seen in the rickets. Okay, what is this picture? Any idea? Question number 5. What is this picture? Any random guesses? Okay, can anyone tell me what can you see in this picture? What is this? Very good. So abnormal fusion of the digits, abnormal fusion of the digits, abnormal fusion of the digits is nothing but syndactyly. So abnormal fusion of the digits is nothing but syndactyly. This is the X-ray picture. These are very important X-rays, very important clinical questions. Like I've made the paper as clinical as possible. Okay, what is this? What can anyone tell me? Question number 6. What can you appreciate in this picture? Yeah. So this is nothing but tetralogy of Fallot. This actually is a nothing but boot-shaped heart. This actually is picture this X-ray which is like this, like that. So this is nothing but, usually it is a boot shaped heart. I didn't this time, I didn't take the classical boot shaped heart, but this is a boot shaped heart. You should know the various varieties. How does it look like? So tetralogy of Fallot, number 1. Number 2, it is one of the congenital heart disease with oligemic lung fields. Okay, oligemic lung fields. It is one of the congenital heart disease with oligemic lung fields. What is oligemic lung fields? Decreased pulmonary blood flow. Okay, the oligemic means decreased pulmonary blood flow. Okay, again, I will be to the point. We can't discuss in detail of the theory, otherwise this class will go for 6 to 7 hours. Okay, so number 1, this case is nothing but tetralogy of Fallot. Number 2, this is nothing but boot shaped heart. Number 3, this very important, tetralogy of Fallot. Tetralogy of Fallot, very important. It's one of the congenital heart disease with oligemic lung fields. Or what is oligemic lung fields? Decreased pulmonary blood flow. Decreased pulmonary blood flow. Because naturally, in tetralogy of Fallot, you have pulmonary stenosis, right? So it's nothing but decreased pulmonary blood flow. Okay, kindly mute your mic. Any doubt you have, you can just put in the comment section. So that's it. So the answer is that only, my dear, that it's a case of tetralogy of Fallot and it's from the congenital heart disease with oligemic. Okay, that you should know. Next one. So and increased pulmonary blood flow. See, this is a condition showing increased pulmonary blood flow. Okay, this is showing increased pulmonary blood flow. So increased pulmonary blood flow, when it is there, so I'll be telling as a plethoric lung field. This is one of the condition of plethoric lung field. Okay, increased pulmonary blood. When there is an increased pulmonary blood flow, then normally these X-ray looks like this plethora, like increased pulmonary blood flow, right? So that you should know. Okay. Yeah. So increased pulmonary blood flow, and yeah, this is the one. And the conditions. Can anyone tell me what are the conditions having increased pulmonary blood flow? Any idea? Yeah, very good. So Ramya has already come with an answer. Atrial septal defect, ventricular septal defect, patent ductus arteriosus. All Annapurna is very right. So ASD, VSD, PDA, all the left to right shunts. All the left to right shunts in general are having increased pulmonary blood flow. They are the pulmonary plethoric conditions. They are the congenital heart with increased pulmonary blood flow. ASD, VSD, PDA, atrial septal defect, ventricular septal defect, and patent ductus arteriosus. More conditions are also there, like Reshma and Akash are answering, but right now, at least for the newcomers, I'll stick to this thing. Okay, so this is plethoric lung field. Okay, what is this? Any idea? What did you write for this question? What is this? Any random guesses? So what is this? It's nothing but a case of, any idea what is it? Yeah, very good. So Rimsha has come with a very wonderful answer. This is nothing but kind of a water bottle shape heart. Water bottle shape heart, or also known as money bag appearance. Money bag appearance. Water bottle shape heart or a money bag appearance. So that you should know. Okay, what do you called? Yeah, over. So that's it. So money bag appearance of water bottle shape heart, that you should know. This is one of the conditions. Yeah, pericardial effusion. Next question. What is this? Any random guesses? What do you call this condition? Kya ho raha hai yahan pe? What are you thinking of? Any random guesses, Annapurna? So yeah. So number 1, what is this? Macroglossia. Macroglossia. See, now this actually was a wonderful class. You guys are really lucky that we have actually got a very classy class of X-rays, because it's a different picture altogether. So macroglossia, this picture I can see. Can you see this part of the limb is little bigger and this part is little smaller? So hemihypertrophy of one side of limb, hemihypertrophy of one side of limb. So this best it fits in the this best it fits in nothing but Beckwith-Weidman syndrome. This classical picture comes best fit in the Beckwith-Weidman syndrome. The points of the Beckwith-Weidman syndrome are: number one, the baby will be large for gestational age. He'll be a big baby, large for gestational age, right? Large for gestational age. So the points are macroglossia with microcephaly with hemihypertrophy of one side of limbs, and these babies have increased incidence of umbilical hernia. These babies have increased incidence of Wilms tumor, and omphalocele. Okay, that you should know. These are the classical points of the Beckwith-Weidman syndrome. So the answer was Beckwith-Weidman syndrome. Okay, what is this? What did you write for this, Annapurna? What did you write? So yeah, so that's very easy. The two arrows are there, no? So choanal atresia, very important. So it is a bilateral choanal atresia. Every question which I have made is linked to a AIMS question, linked to a NEET PG question. The question was like, see this one, okay? This is my nose, this is my mouth, and this is my chin, okay? So choanal atresia, so this part is blocked like this, okay? If I pass a nasogastric tube like through the nose, if I pass the nasogastric tube, I'm not able to pass the nasogastric tube, but I'm able to pass the orogastric tube. So what is the diagnosis? The diagnosis is the child is suffering from choanal atresia. What is atresia? Atresia means abnormal narrowing, okay? Abnormal narrowing. Are you understanding? The question is, a newborn baby born with not able to pass a nasogastric tube, but he is able to pass a orogastric tube. What is the diagnosis? The answer is choanal atresia. One more question was there. A newborn baby, very important question. The newborn baby, the distress, like when the distress, a newborn baby having distress, but his distress decreases on crying. Very important. That's again the answer is choanal atresia. I'll repeat again. A newborn baby who is having distress, but his distress decreases on crying. Okay, so that's very important, because when the baby is quiet, no, when the baby is not crying, he's quiet, and this baby is having choanal atresia, right? So he'll not be able to take the breathe, right? He's not be able to take the breath, so he'll become sinus distress and all that, right? But when he cries, so he's taking a breath for crying. So for crying, he's taking a breath inside. So once he's taking the breath inside, cyanosis improves. So again, question number 5 aims choanal atresia. Finish. So it's a case of bilateral choanal atresia. Finish. Next question. Fast, fast. What is this? What is this picture? What can you see? What do you call this? This kind of a tree shape. Can you see that? Like this trees, this one. Can you see this? So this is nothing but air bronchogram. This is nothing but air bronchogram. It is seen in hyaline membrane disease. It is nothing but air bronchogram, and it is seen in hyaline membrane disease. Remember that. It's nothing but air bronchogram. Okay. So it's a air bronchogram. No, please read this line. It is a very important feature of hyaline membrane disease. Like you see a whiteout lung. You see a whiteout lung in the hyaline membrane disease, because surfactant has not formed. So lungs are not properly made properly. So it's like a whiteout picture, you know. And in that case only you see air bronchogram. Air bronchogram, remember, it is a tubular outline of an airway. This is the Nelson definition. Air bronchogram is a tubular outline. It is a outline of an airway made visible by filling of the surrounding alveoli by fluid or inflammatory exudates. Okay. Can you draw an X-ray, dear? This one, see, can you see that this small lines, like a matchstick appearance, like small matchstick, like that? Okay, so that you should, this small one, the one I put in the marks, no, that one. So these air bronchogram, these are the outline of an airway made visible. Why it is visible? Because outside everything is fluid. It is hyaline membrane, transudation has happened, and everything is a fluid outside. Only this small linings are left. So it's a tubular outline of an airway made visible by filling the surrounding alveoli by fluid or inflammatory exudates. That's it. Okay, what is this? So obviously, this is the best picture we can think of. Again, whiteout lung. See, in your exam, okay, only whiteout lung picture, most commonest, you should think of respiratory distress syndrome or hyaline membrane disease. So this picture is nothing but a case of whiteout lung, and a whiteout lung it is seen in hyaline membrane disease. Okay, I hope you're able to understand. Okay, what is this? Any idea? I'll not tell you the answer. What is this one? So Ramya, it is not this is not an artifact. This one, this is the endotracheal tube. Where are you saying artifact? This one you're saying? No, this is something else. Okay, so that's it. This one. So this one, this is nothing but this is very important endotracheal tube. Okay, endotracheal tube. Okay, the this arrow is nothing but endotracheal tube. Okay, and so that's it. This is an endotracheal tube. Yeah, that's very easy. Next, what is this? Any idea? What is this long pipe going down? So it's a nasogastric tube. So it's a nasogastric tube, and remember, it could be a orogastric tube also. Okay, it could be any tube which I have taken. Either I have put the tube from the nose, or I have to put the tube from the mouth. So it could be a nasogastric tube, or it could be a orogastric tube, but it is a long tube. That's for sure. Okay. Condition. Where do you see this condition? So you already know that. So which is already over. Yeah, this is a very good one. This question, this is the which question is it? Question number 15. Question number 15. The answer is all of the above. It is on the very important, aims question. Okay. Round one shadow is an artifact. Don't worry about it. It could be a small pad or some here and there. So it's an artifact. Imagine that way. So it's a very important aims question of the whiteout lung. Whiteout lung. Even my grandmother knows that whiteout lung it is seen in hyaline membrane disease, but these all are very important causes of whiteout lung. I am helping you out to put all the platform in one place. Okay. So this infracardiac TAPVC, also known as obstructive TAPVC, pulmonary alveolar proteinosis, surfactant the protein B. SPB is surfactant protein B. Surfactant protein B deficiency. Massive pleural effusion, and group B streptococci in newborn. These all are the conditions where do you see whiteout lung. Very important. Okay, please इसको तो रट लेना कहीं से, ये बहुत important है. Okay, next. Okay, so I'm a 29 weeker baby who was born through LSCS. I developed distress. I develop tachypnea, nasal flaring, retractions, everything after birth. My chest X-ray is attached. So tell me my treatment plan. So what do you want to do in this picture? What do you think? So yeah, so it's a case of hyaline membrane disease, nothing but respiratory distress syndrome, nothing but a condition seen in preterm babies. Nothing but sir, lungs are not matured, sir. So surfactant is not formed. So surfactant basically, so lungs are not matured, showing a whiteout picture. So in that case, obviously the best will be giving a surfactant therapy. Okay, we have various types of surfactant like Baractant, this Poractant, bovine extract, calf extract. That is too much in detail. Surfactant you should give. That's it, and respiratory support. Next question.